So there are 13 new cases of COVID-19 in the community to report today. All of these are in Auckland, and the total number in this outbreak now is 996. There are now 460 cases who have recovered, which is great news. 15 of those are in Wellington, and the remainder are in Auckland. There are also 5 border-related cases to report in recent returnees in our managed isolation facilities. As of late this morning, all but one of today's community cases are linked to known cases, with most being household contacts. The interview is underway with the remaining case, and this is a person who presented to Middlemore Hospital with no COVID symptoms, but who was swabbed as part of the wider testing now underway at Middlemore. There are 19 people in hospital today still with COVID-19, and 4 of those are in intensive care units, all requiring ventilation. We continue with our comprehensive testing program, and yesterday there were 17,578 swabs processed around the motu. Across the Auckland region yesterday, more than 9,100 swabs were taken, which includes nearly 2,500 tests of both symptomatic and symptomatic people in our 7 suburbs of interest. In addition, around 2,300 essential workers were swabbed. Another of the new cases today is a truck driver who has travelled over the Auckland boundary as part of their work to make deliveries. This driver is being interviewed by Auckland Regional Public Health to determine whether there are any locations of interest. If there are, these will be put up on the Ministry of Health's website. There may well be exposure events, but they may not become locations of interest if there is just 1 or 2 or a small number of people and all those people are known. The driver was tested after isolating as a household contact of another case. This case does emphasise the importance of our approach to testing people travelling across the Auckland boundary. Just a reminder that after 11:59 p.m. this evening, all permitted workers who cross the alert level boundaries must be able to show proof that they have had a COVID-19 test in the past 7 days. This is in addition to the evidence they need to show that they are permitted to cross the boundary. As this is surveillance testing, permitted workers who have these tests are not required to isolate or stand down while awaiting the test result. Police will begin checking compliance with this requirement from midnight tonight, and people who cannot provide the required information will be turned back. I do want to thank the employers of permitted workers who've been working closely with our teams across government agencies to ensure that their workers will be able to comply with the requirements. Many employers have made arrangements for on-site testing. And those who need to get tested, if it's not on-site at your place of employment, you can of course go to any of our community testing centres or a GP. There is also going to be a pop-up testing centre at the mobile station in State Highway 1 at Meremere from tomorrow. As well, there are saliva testing pick-up and drop-up points throughout the country and near the Auckland boundary at Waitomo, Bombay and the Waitomo Tehana stations operating from 7 a.m. to 7 p.m. Monday to Friday.
This morning, the first of our mobile vaccine buses were launched in Auckland before heading out to parts of the city where vaccination numbers have been lower or people haven't been able to access vaccination centres easily. 3 buses were launched this morning, with one heading to the supermarkets along Lincoln Road in West Auckland, one based at the Pukekohe Countdown and the other at the Papakura train station. Another 3 are having their final kit out today and will be deployed over the next couple of days. And we'll be looking to build up the fleet even further over the next week to take full advantage of the 12 vehicles being provided, and special thanks to Auckland Airport. We are working closely with our Māori and Pacific provider partners and community leaders to determine what locations to target, with a particular focus on suburbs where we want to ensure vaccines are accessible. While we're at alert level 4 in Auckland, they will be positioned in places that allow for people to be vaccinated at a safe distance from one another, and also for people to be observed at a safe distance from one another. In the future, though, we anticipate they will be a bit more mobile and therefore a bit more residential in where they go and how they're able to perform their job. Meanwhile, we've hit another milestone. Today we hit 3 million first doses delivered nationwide, representing over 70% of our eligible population. This is a significant milestone, so thanks to all those who have been vaccinated so far. But we have the capacity to do even more and even faster. We have the ability to get to 80% of Aucklanders vaccinated with their first dose by the end of the week. Nearly 37,000 first doses were delivered in Auckland in the last 2 days, but we need to do even better again. For those of you who are yet to get that first vaccine, I encourage you to get out there and to do it today. Head to your nearest drive-through or walk-in provider and join the tens of thousands of Aucklanders who have done their bit this week. It's the most important thing you can do to help us as we work together to get out of lockdowns. If you're not sure where to go, I want to explicitly mention the places where you have options. These are places where you don't require a booking. In the south, there is the Airport Park and Ride, the Papakura Marae Vaccination Centre, the Manurewa Vaccination Centre at 81 Finlayson Ave, Clendon Park, the Otara Vaccination Centre at 5 Otara Road, the Pukekohe Vaccination Centre at 6 Ralston Street, and the Takanini Vaccination Centre at 8 Great South Road. If you're out west, you've got the option of the Trusts Arena at Central Park Drive, the Henderson Vaccination Centre at 28 Catherine Street, or the Westgate Vaccination Centre on Westgate Drive. And if you're in central Auckland and looking for a walk-in opportunity, there's the Vaccination Centre at 35 Graham Street, our recently established CBD site, the Epsom Vaccination Centre at 382 Manukau Road, the Mount Wellington Vaccination Centre on Leonard Road, Mount Wellington, or the Tamaki Glenis Vaccination Centre on Moran Road. If you're in the north, drop into the North Shore Airport drive-through vaccination centre on Postman Road, the Albany Vaccination Centre or the Birkenhead Vaccination Centre. That one's at the corner of Highbury Bypass and Birkenhead Avenue, and again, these are all available for drop-ins. If you're in the east, you can visit the Highbrook Vaccination Centre at 31 Highbrook Drive, and of course, if you're in the south or the west, keep an eye out for the mobile buses. And remember, again, you can turn up at any of these sites. No bookings, there is spare capacity, take your whole family bubble with you, and of course, it's completely free. As I said, with COVID, our efforts to defeat the current outbreak, vaccinations are incredibly helpful, both now and into the future. Before I finish today, though, I want to touch on questions we've had on whether there will be any changes made to the alert system going forward. We all know Delta is more dangerous and more difficult, and because of that, we have adapted our response. A few weeks ago, we stepped into Alert Level 2, and we made changes to reflect the risk we faced. We also said we would consider whether we needed to do the same to Alert Level 1. Cabinet has considered the settings at Alert Level 1, and we've received the advice of Dr. Bloomfield and the public health team. We've reached the conclusion that Alert Level 1 will remain the same. At this level, we are prepared. And prepared means, of course, we scan, we wear masks in high-density places where it's hard to contact trace, like buses, but we don't have COVID in the community, and so we otherwise have pretty normal lives. That remains the objective of Level 1, and we don't believe it needs to change, even with Delta. But the most important consideration here is that Alert Level 1 has always been for an environment where there is no risk of community transmission, where COVID, or indeed Delta, doesn't present a risk, when it's outside our border walls, not in it. That means, so long as Auckland is in the higher alert levels of 3 or 4, we believe we will need a greater level of preparedness in the rest of the country. Right now, while Auckland is at alert level 4, the rest of New Zealand is in a very high level state of precaution. We entered in on the top rung of Delta Alert Level 2. We do not believe that the rest of New Zealand will need to necessarily stay on the top rung. If on Monday we confirm our in-principle decision to move Auckland to Alert Level 3, we will consider specifically an increase in the number of people who can gather together, including in hospitality venues. We anticipate this would be lifted to 100 people. Essentially, as Auckland moves down, the rest of New Zealand can ease a little too, whilst remaining on high alert. While final decisions will be made at Cabinet, we wanted to give a forward preview of our direction of travel. Businesses have rightly been asking if we can give signals in order for them to best prepare. What is clear from our consideration, though, is that our alert level system served us very well over the last year and a half, but as vaccines become part of our toolkit, we need to integrate them into our alert level system. We're doing some thinking on this as we speak, and we'll keep you updated on that work.